Assalamualaikum and good afternoon. Thank you for your time to listen to my presentation. I will present to you about a pathology, herniated nucleus pulposus. Okay, herniated nucleus pulposus is a condition where partial or all of the soft gelatinous central portion of an intervertebral disc is forced through the weakened part of the disc, resulting in back pain and nerve root irritation. The displacement of the spinal disc material that consequently leads to mechanical compression of the nerve roots. So, in easy understanding, it's defined as the center of the intervertebral disc protrudes through the annulus fibrosis, the ring of the vertebral disc, and herniated and compress the nerve root or the spinal cord. So this is the stages of PID, which involve the herniated of the nucleus pulposus. This one is the normal disc. The nucleus pulposus is in the center of the vertebral disc, surrounding by the annulus fibrosis. Um, Okay, this one is the stage of the bulging of the disc, but the nucleus pulposus is still intact in the disc. This herniation, this one, the nucleus pulposus starts to push any weakened or thin wall of annulus fibrosus, but the wall did not break. For this prolapse, the nucleus pulposus starts to protrude uh, through the annulus fibrosus, but still in contact with the disc. For the stages of desequestration, the nucleus pulposus completely escape the disc and become a free fragment in the spinal canal. So this one, image of vertebra and intervertebral body. This one shows the nucleus pulposus herniating into the spinal canal and compress the nerve root. This herniation is more common in the uh, lumbar spine. It is equally common in the cervical and thoracic spine. Lumbar spine bears a majority of the body weight and added pressure, which can lead to disc degeneration and herniation. It also involves in flexion, extension, and rotation of the lower back, particularly during lifting and bending, making it prone to wear and tear. So, in cervical spine supports the head and head movement, which require wide range motion. So, herniated nucleus pulposus is common in the lumbar and cervical due to the combination of high mobility, mechanical stress, weight-bearing functions, and natural spinal curvature. In contrast, the thoracic spine is less affected due to its rigidity and protection from the ribcage. So this is the normal disc. The nucleus pulposus is in the center of the vertebral disc. And for herniated disc, the center protrudes and compresses the nerve root. So the disc anatomy consists of two main structures, which are the nucleus pulposus in the center of the vertebral disc and the annulus fibrosis surrounding the nucleus pulposus. Nucleus pulposus is composed of water, type 2 collagen, chondrocyte cells and proteoglycans. These unique composites allows nucleus pulposus to be elastic, flexible under stress force, and to absorb compression, while the annulus fibrosus mainly concentric layers of collagen type 1 fibers, forming a fibrous tissue with helical disposition surrounding the nucleus pulposus. This structure is denser in the anterior part and is attached to the vertebral body by Shapri fibers. Causes of herniated nucleus pulposus. The most common cause of this herniation is degeneration, a slow age-related wear and tear. The discs become less flexible with age and are more likely to tear or rupture at the slightest twist or pressure. This example of the herniated disc, bulging disc, herniated disc, degenerative disc, and thinning of the disc. Sometimes severe injury can cause a normal disc to herniate. Injury may also cause an already herniated disc to worsen. Most people are unable to identify the reason behind their herniated disc. A herniated disc can occasionally result from lifting large objects with the back muscles rather than the leg and thigh muscles. A herniated disc can also result by twisting and rotating while lifting. A traumatic incident like a fall or a hit to the back is rarely the reason. Sign and symptoms. Most herniated discs occur in the lower back, but they also can occur in the neck. Symptom depends on where the disc is sitting and whether the disc is pressing on a nerve. Herniated discs often affect one side of the body. Uh, Arm or leg pain. If the herniated disc is in the lower back, typically patient will feel pain in the lower back, buttocks, thighs, and calf. They might have pain in the part as the foot as well. So when the this compress the nerve, patient will feel the pain radiating to lower part or other area. If the herniated disc is in the cervical, it will typically feel the most pain in the shoulder and arm. This pain might shoot into the arm or leg when cough, sneeze, or move into certain positions. Pain is often described as sharp or burning. Patient also will experience numbness or tingling when they have herniated disc, and this pain or often radiating numbness or tingling in the body part served by the affected nerve. Usually, if they have it occur at the cervical area, patient tend to feel the pain and at the shoulder and along the arm. Weakness. Muscles served by the affected nerve tend to weaken. This can cause to stumble or affect the ability to lift or hold item. Patient will feel difficult to do their activities, to hold heavy things. Patient can have a herniated disc without symptom and might not know they have it unless it shows up on spinal image. So for the complication, the compression effect on the nerve root will result in motor deficit, which cause the patient to lose or has impairment of voluntary muscle movement, and the risk of spinal cord compression of the cervical or thoracic. The complication will affect the patient daily routine or activity. When they feel pain, they cannot do um, the activity. Imaging modalities includes general X-ray, CT scan, ultrasound, and MRI. For general X-ray, plain radiograph of the spine can be obtained when there is suspicion for herniated disc, but it is not a primary diagnostic tool for HNP. X-ray cannot directly visualize the soft tissue, such as intervertebral disc, spinal cords, and nerve roots. And X-ray is not sufficient to diagnose HNP, but can be part of the initial evaluation to rule out other conditions. In this image, we cannot clearly see if there is a problem with the disc, but we can see sometimes the level of the no the level of the vertebral disc, whether it is thinning or not the same size as other disc. For CT scan, it is not usually requested in view nucleus pulposus, but useful for patients who cannot undergo MRI. It can offer good visualization of bone and some soft tissue, especially with myelography. For example, the image shows the low signal intensity, which can be explained by the vacuum phenomena due to nitrogen gas within the herniated disc, both on the L4, L5, and the L5S1 level. This one indicates the herniated disc. The vacuum phenomenon is a clear indicator of disc degeneration on CT scan and can help guide diagnosis and management. CT myelography can be used when MRI cannot be performed or for better visualization of nerve roots and thecal sac. The procedure needs to use contrast, which injected into the spinal canal to enhance the nerve root compression or any impingement. So this one shows the spinal cord, intervertebral disc, stenosis, contrast field spinal canal with stenosis here. Ultrasound occasionally used for evaluating nerve root or peripheral nerve involvement, but limited for diagnosis. This is because poor penetration of the spine. Ultrasound wave cannot penetrate the spine well enough. The disc and nerve root are deeper structures, not well seen with ultrasound due to the bone obstructing sound wave. Lack of detailed soft tissue imaging. It cannot provide detailed visualization of the disc material or the thecal sac. This is an example of herniated disc material in ultrasound image. This one vertebral body, disc, and this one is the herniated material. MRI is effective in detecting both direct and indirect signs of the pathology. It can provide detailed image of soft tissues, including intervertebral disc, nerve roots, and spinal cord. It also can detect the disc herniation, nerve compression, associated conditions like spinal stenosis, and no radiation involved. The limitation for MRI is it is not suitable for patients who have implants, and MRI also take a long time to scan. This is example image of the MRI. This is spinal cord, vertebra, herniated disc. This one is a normal image for cervical spine. This one shows the herniated disc. Focal protrusion at the L5 S1 level where the S1 nerve is compressed. This one is the level of L5 and S1. Okay, this is a sagittal image, show the protrusion of the disc, and this one is the axial image. This one, the protrusion of the disc here. MRI is considered the best possible tool for looking at spinal disc. The main difference between MRI and X-ray or CT scan is that an MRI can look at soft tissue, not just bone and joints. So we can see uh, the CSF, fluid clearly, vertebral body, the difference between the normal disc with high signal and the disc with pathology, low signal here. Advantage of MRI in diagnosis. The biggest advantage of MRI is that it can obtain image through horizontal and sagittal three-dimensional scanning, different sequence and imaging technique, and directly observe the normality of the spinal cord, subarachnoid space, vertebral body, and intervertebral disc. For intervertebral disc disease, the signal level can be directly observed. There is a relationship between the position, direction, shape, and size of the nucleus pulposus and the nerve roots of intervertebral disc herniation. Compared with CT scan, it has more imaging parameters, multiple tissue variable functions, more flexible and extensive, no radiation, and no damage to the human body. And its diagnostic accuracy is better than that of CT scan. Technical consideration for patient positioning. Place the coil and fix it on the examination bed. Patient will lie on its back. The long axis of the body is consistent with the long axis of the bed. The arms are placed on both sides of the body or crossed in front of the chest and abdomen so that the patient's position is relaxed and suitable. The shoulder should be pushed up as far as possible so that the lower part of the joint coil can include the tail of the skeletal body. The sagittal positioning cursor is directly on the center line of the body, and the axial positioning cursor is at the level or slightly above the skeletal level. Enter the bed to the inner hole of the magnet after lock position. This is the image. Okay, patient lies supine. This is the coil that for cervical spine. Coil for thoracic and lumbar spine usually on the table behind the patient, and we put some sponge to support the patient's leg and to straighten the patient's spine. Sequence and protocols. Sagittal image. T1 weighted image provides high resolution anatomical detail, help differentiate this material from fat or other tissues. Herniated disc will show low signal intensity compared to surrounding structures. T2 weighted phase will highlight the fluid containing structures such as the nucleus pulposus, CSF, and inflammation. Normal disc will appear hyperintense or bright signals in the nucleus pulposus due to hydration. Herniated disc will show low or intermediate signal intensity protrusion with possible compression of bright CSF around the nerve roots. So radiographic appearance, central segmental disc herniation. On axial image, this one shows that the nucleus pulposus of the intervertebral disc protrudes into the central spinal canal area, and the dura and both sides of the nerve root compress. On the sagittal image, the T2 shows the signal of intervertebral disc at L5S1, and the height of the disc is reduced. This one, L4 and L5 intervertebral prolapse. T2 show the content of the intervertebral disc protrude into the left central spinal canal and the subarticular joint here, the darker one. And the sagittal image show the nerve root and dura site were significantly compressed. And this one for intervertebral disc lateral prolapse, T2 show the content of the intervertebral disc protrude into the right central. This one. Sorry, the arrow. This one is the protrudes one. And the sagittal show the right nerve root, and most of the dura site are compressed obviously here. And the cauda equina in the dura site is compressed to the left side, and the right central spinal canal and recess are obviously stenosis. Okay, another example of MRI image. Direct signs can be seen in the low signal outside the annulus and other signals, and T2 medium, intermediate, bright, and long signals bright or hyperintense. These control abnormalities can show the protrusion, extrusion, or sequestration. Depends on the degree of the herniation. In the case of obvious degeneration, T2 has short signal, which is dark or hypointense. And it can be seen that the intervertebral disc is thinning in the sagittal position, this one. And the intervertebral disc in the transverse position exceeds the edge of the vertebral body. Indirect signs can show the compression of the dura sac, nerve root or spinal cord compression, and tortuous epidural venous plexus, and changes in the bone structure and bone marrow of the interface zone. So conclusion, these herniations are common causes of lower back and leg pain. This herniation can manifest in spine radiculopathy, neurogenic claudication, and cauda equina syndrome based on the location and size of the herniation and other possible associated pathologies. Physical examination with advanced imaging is essential to reaching an accurate diagnosis. Standard first-line treatment commonly includes medication therapy and physical therapy. Spinal steroid injections are useful for diagnosis and treatment if these measures fail. Non-surgical modalities are successful for most cases, but a referral to a spine surgeon may be necessary if symptoms continue or worsen. Okay, that's all. Okay. Thank you for your time for my presentation. Anybody have any question? You can ask, and I try to answer. Okay. Is there any classification to identify the severity of this herniation? Okay. Yes, there are classification. As I mentioned before, the HNP can be classified to identify the severity of this herniation. As I mentioned before, it can be classified based on the finding on MRI whether this um, uh, okay, this one, the classification, either this is bulging when the disc starts protrude outwards, but the annulus fibrous remains intact, and this herniation, annulus fibrosus did not break, and this prolapse when the inner nucleus pulposus start to protrudes through the annulus fibrosus, and the last one is this sequestration when the nucleus pulposus completely escapes and becomes a free fragment in the spinal canal. Okay, how can we, how, another question is, how can we differentiate between HNP and other causes of back pain? Mm, HNP, the pain typically radiates along the nerve roots for lumbar usually, may cause sciatica, which is pain radiating down the leg. And it also associated with neurological deficit such as numbness, tingling or weakness, and the pain may worsen by coughing or sneezing or straining due to increase in intradis pressure. Other causes of back pain, um, the neurological symptoms will less common in muscle strain or mechanical back pain, and uh, other causes uh, selain HMP may experiencing localized back pain without radiating to other area. For HMP, the pain will radiating to other area such as sciatica. Patient will feel pain over the leg, not only at the back. So, in spinal stenosis also, the pain is relieved by bending forward of sitting. Okay. Any other question? Okay. Thank you for your time, and I hope all of you will get something from my presentation. And with that, thank you.